Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews, here in the studio today with Maynard Nexen healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
Today we're excited to be joined by a leader in healthcare. Mark Wainner is the president of the Ambulatory Surgical Center Association. The ASCA, as it's known, represents the interests of the growing ambulatory surgical center industry before medical and regulatory bodies and advocates for quality standards. Mark, thank you for joining us today.
I appreciate you having me on.
We're excited to discuss the growth of ASCs and their impact on the healthcare industry, but before we dive in, could you start us off by telling us about your career and how you came to lead the organization?
Absolutely. I got involved in surgery centers roughly about 30 years ago. I was actually in pathology sales, and I was selling to a surgery center, and then had an opportunity to go to work for a surgery center management company called AmSurg for about 23 years. Did a number of different roles with AmSurg. During that time, I got affiliated with ASCA, as AmSurg is a member of ASCA, and started to serve on various committees. Actually was the president of the Tennessee Surgery Center Association for a while, and fortunately had the opportunity to get on the board, and have been on the board for a number of years, and am now currently the president. I also have spent a little bit of time outside of the industry during that time, working for a company that did bundle payments, specifically trying to save money for patients and drive cases to a lower cost, high quality setting. And I'm currently with Community Health Systems. I work on surgery center acquisitions and developments for Community Health Systems, Ambulatory Surgery Center Division. So it's great to be here. Thanks for having me.
Great. Well, we're glad you're here. And as a healthcare lawyer, I've been working with surgery centers for, 30 plus years. But why don't you tell our audience a little bit about surgery centers and how they have expanded their role within the healthcare delivery system in the last couple of decades, and why that's beneficial to patients?
Sure. Well, some people don't know what surgery centers are, so just getting a little bit of background on what a surgery center is always helpful. Surgery centers are specialized medical facilities for same-day outpatient surgical, diagnostic, and preventive health services. There are about 6,400 Medicare certified ambulatory surgery centers operating nationwide. There are also a number of ambulatory surgery centers that are not Medicare certified. They utilize advances in anesthesia, the latest medical technologies, the latest surgical techniques with the surgeons that operate in the centers, and the most up-to-date post-operative pain management for after the procedure. We perform many of the same procedures that are performed in hospital outpatient department surgery centers, with the exception of some that are not on the Medicare approved list at this time. And they're a very efficient and cost-effective alternative to hospitals and hospital outpatient surgery centers. And typically what we see is outcomes that are at least equal, or in some cases better than the hospital outpatient surgery center department.
What type of regulatory changes have you seen with the new administration, I guess, and or on a state level? And do you believe the changes you're seeing will benefit both patients and providers?
On the administrative front, a new administration always brings in some changes. First of all, I guess surgery centers are a very highly regulated industry. We must comply with federal regulatory statutes. Medicare certification often also requires independent inspections and compliance reporting each year. There are independent accrediting organizations that Medicare works with for licensure and compliance. So we are very heavily regulated. Each year, when there's a new administration, or every 4 years, and sometimes with the change in the leadership that we have in the House or in Congress, we see changes from a regulatory standpoint. Right now, we're still really kind of understanding what those changes might be. There's always payment changes that are published around July of each year with a proposed edition, and then the final edition comes out in November. So we always anxiously await that proposal to see what's going to happen. We're currently in the comment period on that. So some of those changes might include, how surgery centers report from a quality standpoint. What we're required to report on. As with prior administrations, both Republican and Democrat, we've been able to make considerable progress through the rulemaking to improve our reimbursement, authorize additional procedures that could be performed in ambulatory surgery centers. As far as the Trump administration so far, we're encouraged by what they've proposed in 2026. We'll find out in November if what they've proposed is in the final ruling. Like I said, right now we're in the comment period on that. But right now there appears to be a willingness to expand the covered procedures list for ASCs. They're also making some adjustments to our quality reporting requirements and making some proposed improvements to reimbursement. So we're excited about those potential changes could be coming down the pike. Of course, we still like to see better equalization of reimbursement rates between hospital outpatient surgery centers and ambulatory surgery centers. I think that's something we deal with every year, and we'll be working on from a advocacy standpoint each and every year. None of this is really, criticism of the administration. We've been dealing with these issues for some time now. Each year, it seems like we make some progress on some of our goals and initiatives that we're trying to get across the goal line. And they have this administration has been willing to work with us, and hopefully we'll see some of those proposed changes go into effect.
Let's get into some of the surgery center data points, like the volume of surgeries and quality reporting, as you referenced earlier. Are you seeing an increase in the number of surgical cases that are done at surgery centers versus at hospitals?
We are. There's right now, if you kind of look at some of the numbers, roughly about 23 million total procedures done in surgery centers. Surgery centers have been growing over the years for a number of different reasons. One, they are a cost-effective place to have surgeries performed. They are high quality. We see payers, in addition to CMS, trying to move cases into a lower cost setting for beneficiaries. So we're certainly seeing those things help us. Technology increases, also, better anesthesia, more effective surgical techniques with smaller incisions, with less recovery time, all things that are driving more and more cases into the ambulatory surgery center setting. So we're still seeing a lot of growth in the surgery center space. There are some specialties that have kind of matured in the space, and a lot of the procedures are already done in the ambulatory surgery center setting. And then there's some others that are, I guess I would say, kind of in their infancy, that haven't really moved to this setting for various reasons. So we expect to see growth in some of those areas. But yeah, we're still bullish on the growth of surgery centers and the prospect of being able to to continue to grow our procedures and grow the number of surgery centers. From a cost saving standpoint, there's significant savings for health plans and for CMS for making sure those cases can be done in this setting.
What about quality reporting? I know you mentioned earlier you've got some obligations to report quality, and last time I checked that there was good quality data coming out of ASC surgery centers.
Sure. We the ASC community, as well as ASCA, have long supported Medicare's quality reporting since its inception. We believe that patients and families are entitled to individual facility quality reporting information. We want to make sure that information is meaningful to the patients So there have been some areas where we have pushed back on, where we just don't think what they're asking for really gets at the point that they're trying to get across. We also want to make sure that that data is reported in a way that patients can understand, which is often a challenge. When you report data, patients don't understand CPT codes and HCPCS codes and the various ways that we might gather information. So make sure that that data is digestible for patients and they can understand it. So we believe that the Surgery Center Association and our ASCs demonstrate high quality of care. We have a program, ASC QR program, that is currently requires Medicare-certified ASCs to report on 14 distinct quality measures to CMS each year to avoid Medicare reimbursement reduction. So if they're not reporting, they will be penalized from a reimbursement standpoint. So kind of the stick approach there to getting centers to report that data. And we have about a 93% participation compliance rate as of 2024.
Well, we've talked volume, 23 million. We've talked reporting. Tell me about cost savings. What does this mean for patients? Sure.
Well, Medicare reimburses hospital outpatient departments at about twice the rate of ambulatory surgery centers. Typically, patients have a 20% copay. So, patients will see lower out-of-pocket cost in ambulatory surgery centers. There are a few instances, one of which is part of our advocacy effort right now. Actually, in the hospital outpatient department, there is a copay cap. So there are actually some procedures when performed in an ASC setting where the patient has a higher out-of-pocket, even though CMS reimburses roughly half of what they're reimbursing in the hospital setting. So part of our advocacy is to eliminate that copay penalty on behalf of Medicare beneficiaries. So that's something we're working on right now, trying to get that legislation passed. As far as some actual hard dollars for savings, I've got some statistics on that. According to K&G Health Consulting, ASCs reduced Medicare costs by $28.7 billion from 2011 to 2018. They project that ASCs expect to reduce Medicare costs by an additional $73.4 billion from 2019 through 2028. In 2018 alone, their analysis showed Medicare savings tied to ASC totals $4.2 billion. So it really depends on the movement of those cases into the ASC setting. But in 2028, they're projecting it's about $12 billion savings by moving those cases to an ASC setting.
Yep, those are big numbers.
Also depends on if CMS follows through with moving some of their procedures off the inpatient only list into the ASC list. Those numbers certainly could be realized or even be higher if there's some more cases that can be done in the ASC setting.
Well, let's talk a little bit about your trade association, ASCA, and how it helps the surgery centers industry expand patient access and to continue to improve cost savings. You mentioned some advocacy. I presume that's where you do most of your legislative advocacies through the trade association?
That's correct. The Ambulatory Surgery Center Association is the premier outpatient surgery center association in the country. We have roughly about 5,000 members, good mix of independent surgery centers as well as corporate managed owned surgery centers and hospital owned surgery centers. So we do represent those members. We do quite a bit of education of our members. There's clinical education that we do for those members. There is advocacy efforts on behalf of those members. I mentioned the proposed rule. Right now we're in the comment period on that. So we'll be taking suggestions on what we should include in those comments, and then making comments to CMS with regards to that. And that directly affects those members, their reimbursement, the types of procedures that can be performed at their centers. So we do that directly through the association and our PAC efforts. So it's a great association that represents the industry as a whole. I will say that there are different types of surgery centers that have different needs. A corporate-owned surgery center has a very different need than an independent physician-owned surgery center, as far as education, as far as being able to attend a meeting and learn about the latest things in the industry. That's one of the things that ASCA provides through our annual conference and expo, is educational opportunities to those members. So we're always keeping our finger on the pulse of what the needs of our members are, and making sure that we're representing them appropriately, both in Washington as well as at the state level when we have state specific issues.
You mentioned ASCA's expo. That was last spring. You brought together, thought leaders in the industry. What were the key areas of focus for both the, business innovators and the physician leaders?
Sure. That's our conferences are kind of our premier event. It's very well attended. We had about 1,200 paid attendees, 180 exhibitors, 55 sponsors. We did 63 continuing medical education and training seminars on site. These are put on by experts in the field. I would say the exhibitors turn out for this meeting because they know that our members are very engaged with them. And so from an educational standpoint, there are some things that we always cover, which are things like how to improve your center financials, trying to help help our members understand the challenges that they're dealing with, whether it's from a reimbursement standpoint, staffing standpoint, or supply standpoint. There are a lot of headwinds in the industry right now with regards to reimbursement as well as costs. So, educating them about best practices of how to navigate through that and manage through that. We want them to be around. We want them to be strong. If they're not, then they might not survive, and that's not good for patients and not good for access. So we do a lot around education. We've done a lot recently around anesthesia. We've seen significant challenges with anesthesia. We've seen changes in anesthesia reimbursement that have come back and end up impacting surgery centers through anesthesia providers requiring stipends or subsidies in order to provide their coverage. There's currently a shortage of anesthesia providers. So doing a lot of education around anesthesia providers, how to work more closely with anesthesia providers to staff the center to make it efficient for not just the physicians, not just convenient for patients, but also for the providers, the anesthesia providers that are working there, so that we'll thrive and continue to do well.
Looking at the future, what kind of trends are you looking at? I know when we represent ASCs in the last several years, anesthesia costs has been a big issue, but we've got this physician shortage, not just of anesthesia physicians, but also physicians generally. How will that impact where we're headed in terms of surgery centers?
Yeah, I think one of the big things that we're dealing with now, and we'll probably deal with going forward, is the anesthesia shortage, which is impacting us. I really don't see a solution to that in the short term. Hopefully, the number of anesthesia providers that will be graduating and entering the field will grow, and that will help with the supply and demand. But that's one of the big challenges that we're dealing with now, and I think it's going to continue to get worse. This upcoming meeting that we're having in National Harbor, Washington, D.C. area. Next year, we're actually doing in combination with an anesthesia association called SAMBA.
Good idea.
And the point is to collaborate with them to educate our members to try to create a solution to help solve this problem. We always have a lot of education and training year-round, though. We have about 6,500 of our members and their employees that have attended our first 6 of 9 educational webinars this year. We actually made our educational offering, our virtual educational offering, part of our membership dues this year, which has really driven a lot of that growth, because that's so important that we educate our members. We do a lot to provide CMS with clinical data and expertise so that they understand how procedures can be performed safely in the ambulatory surgery center setting. So we've collaborated with some of the cardiology associations on those procedures, and demonstrating to CMS how those procedures can be safely done in an ASC setting. We did that a few years back with total joints. Total joints were not on the approved list of procedures to be done in the ASC setting until over the last 5 years, and they've added total knees, total hips, total shoulders. And it's really about educating CMS, working collaboratively with peers, and to try to educate them on the quality, and then just working on bringing about more equitable level of reimbursement. And then I mentioned earlier the advocacy that we're doing, and I'll mention it again, the passage of, trying to get the passage of the Medicare Beneficiary Copay Fairness Act to align Medicare copays in ASCs with hospitals and HOPDs. Then the other kind of big thing that's kind of sitting out there we really don't know about is physician employment. There are a lot of physicians that are currently employed, which could be a challenge, or depending on what happens in that area, it could be an opportunity for surgery centers. So we're keeping our eye on that one and the pulse on trying to see how that will affect us going forward.
Well, your plate is full, and with 5,000 members, you have a big audience. So, Mark Wainner, we appreciate your time today. You have informed us greatly on the Ambulatory Surgical Center Association, the good work that you're doing. We thank you for joining us and wish you the best.
Well, thank you very much. It's a pleasure to have the opportunity to do this podcast with you. Thanks for having me on, and thanks for your support of the ASC industry.
Thank you. And for those who've joined us today, we hope you enjoyed this conversation. There's a lot to learn and a lot that's changing in the healthcare industry, and I guess, Matthew, that's never going to change.
I don't think so.
No, and so we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.